Hello, hello! Today we're going to be talking about the extraocular muscles of the eye and palpebrae. The palpebrae, more commonly known as eyelids, are important for protecting the eyeball from injury and excessive light, as well as keeping the cornea moist by spreading lacrimal fluid. The levator palpebrae superioris muscle is innervated by cranial nerve 3 and is responsible for elevating the upper eyelid, thus opening the eye. Orbicularis oculi, which is innervated by the temporal and zygomatic branches of cranial nerve 7, act as a sphincter to close the eye. A helpful way to remember these muscles and their innervations. Levator palpebrae superioris is innervated by cranial nerve 3, which looks like pillars pushing the eyelids open. Orbicularis oculi is innervated by cranial nerve 7, which looks like a hook closing the eye.
Here we have a demo of the eyeball and extraocular muscles. This is the right eye. We have the medial aspect of the orbit here and the lateral aspect of the orbit here. Here in dark blue, we have the superior rectus. In green, we have the superior oblique, and you can see it wrapping around the trochlea over here. We have our medial rectus in light blue, our inferior rectus in yellow, our inferior oblique in purple, and we have in here our lateral rectus in pink. Now you can see that all of the extraocular muscles exit the orbit at the apex, with the exception of the inferior oblique, which exits at the anteromedial aspect of the orbit. Looking at the functions of the muscles, our superior rectus elevates the eye. Our inferior rectus depresses the eye. Our medial rectus adducts the eye. And our lateral rectus abducts the eye. Taking a look at our oblique muscles now, our superior oblique is going to depress, abduct, and intort the eye, like that. And our inferior oblique is going to elevate, abduct, and extort the eye, like that. Now, to test these extraocular muscles in a clinical setting, we need to isolate each of the muscles that we're testing. When we have the patient abduct the eye, this is isolating our lateral rectus muscle. When we have the patient adduct the eye, this is isolating our medial rectus muscle. Now it gets a little more tricky when we're looking at our superior and inferior rectus and oblique muscles. In order to isolate our superior rectus muscle, we're going to have the patient look laterally first and then elevate their eye. And this is isolating our superior rectus. In order to isolate our inferior rectus, we have the patient look laterally and then depress their eye. And this is isolating inferior rectus. In order to isolate our superior oblique, we're going to have the patient adduct the eye, and then they're going to depress the eye. And this isolates superior oblique. And in order to isolate inferior oblique, we're going to have the patient adduct the eye and elevate their eye. And this is going to isolate inferior oblique.
Here is a little summary of what we just talked about, so feel free to pause the video and review on your own. That's all for now, folks. See you next time.